there are two very effective ways to treat depression. One is through cognitive behavioral therapy, and the other is through medication. Some research has even shown that cognitive therapy is more effective than medication, and that the effects last longer than medication. First, I'm going to talk about cognitive behavioral therapy. Cognitive therapists believe that depression is related to the way a person thinks. If you have been depressed yourself, you know that the thoughts of a depressed person are pretty negative. A depressed person tends to have a negative view of herself, the world, and her future. She may have thoughts such as, "I'm a loser," "I'll never get a good job," and "other people think I'm not smart." Often the thoughts of a depressed person may not actually be true. However, people tend to automatically assume that whatever they are thinking is the truth. Depressed people also have rules that they live by that can dispose them to depression, although oftentimes they are not even aware of these rules. For instance, "I should always look perfect," or "if I don't get this deal, then I'm a failure," or "if my relationship does not work out, then that means I'm unlovable." Do any of these rules sound familiar to you? You can begin to see how someone with these kinds of beliefs might get depressed when something happens in their life that relates to one of these rules. So if someone who has the rule, "if I don't get the job, then I'm worthless," is turned down for a job, they would likely become depressed. This kind of negative thinking can lead to feeling helpless and hopeless, which can make it very difficult for the depressed person to try to solve problems in their life. Depressed people also tend to focus on negative things in their lives rather than positives. Unfortunately, the depression can act as a screen where negative information gets through but positive information is blocked, which again serves to maintain the depression. So now you know that when you're depressed, the way you think is not only negative, but is also not necessarily accurate. So what can you do about it? Well, in cognitive therapy, the therapist and client work together to examine the way that the client is thinking and the rules that they are operating under, which may be maintaining their depression. Therapy will then focus on seeing the world in a more accurate way and developing some new rules to live by. For example, someone living under the rule, "if I don't get straight A's, then I'm stupid," needs to reevaluate that rule. Is this rule really true? Would you apply it to others? Is it helpful to you? What are the advantages and disadvantages of living by this rule? Is there another rule that could be substituted that would be more useful? Therapy will also help you learn to focus on your strengths rather than on the negatives. Although this sounds simple, it's really quite powerful. In addition, the therapist will help you develop problem-solving skills and feel empowered to change or cope with difficulties. The other important aspect of depression besides the way one thinks is what one is actually doing in their day-to-day life. As you well know, depression often leads people to withdraw. They stop seeing friends, stop going to the gym, or doing other activities they enjoy, and turn inward. Well, unfortunately, withdrawing has the effect of making the depression worse. In fact, it becomes a vicious cycle. When one stops doing the activities that were normally satisfying, whether that was playing golf or going to a book club, they reduce the possibility of gaining pleasure in their life. Sometimes people stop doing these activities because the depression makes the dinner with friends less fun, or the dance class less enjoyable. The luncheon with friends or closing the big deal at work is no longer as satisfying as it used to be. However, as human beings, we need opportunities for pleasure and mastery in our lives in order to feel fulfilled. So when we stop doing the things that were once rewarding, we lose out on these opportunities, thereby fueling the depression. So the other key part of treatment for depression is focused on scheduling activities that will be rewarding. For a depressed person, this can be difficult because several aspects of depression, such as the sad mood, lack of energy, difficulty concentrating, and insomnia, can affect an individual's motivation to start doing these activities. However, the idea that motivation must be present for action to take place is an erroneous idea. In fact, often motivation follows from action. For example, how many people actually want to go to the gym? I'm guessing not many. However, I'm also guessing that once you do get to the gym and get on that treadmill, you feel motivated to be there because you are taking action in your life. You feel better now that you're doing something. So the basic principle behind behavioral treatment of depression is to get the depressed person to start doing things that will lead to pleasure and a sense of satisfaction, whether that's exercise, spending time with friends, taking a class, or whatever. The point is to get active even though you don't feel like it, because it will help you fight that depression. In fact, a recent study found that doing more activities alone helped people to recover from depression. So this gives you an idea of what cognitive behavioral therapy for depression is like. The difference between cognitive behavioral therapy and other types of therapy for depression is that it gives people tools to use to help them overcome their depression. This is very important because, as I mentioned earlier, if you have had one period of depression in your life, there's a fair chance that you may have another. However, if you have learned skills to cope with your depression, if and when it strikes again, you can tackle it. Cognitive therapy is also different from other types of therapy for depression because it focuses not just on talking about your problems, but actually doing something about them. The other option for treatment is medication. There are many different medications that are used to treat depression. And for some people, a combination of medication and therapy is the best treatment. However, since depression is manifest differently in everyone, it's best to consult with a professional before deciding on the best course of action for you. I hope this presentation has been helpful. For more information on depression and how to get treatment, please go to our website at www.cognitivetherapinyc.com.